Congress is currently discussing a new budget proposal. According to the plan, up to $880 billion in spending could be cut over the next decade from federal programs, including Medicaid, for more than 72 million Americans, including the elderly, low-income individuals, and people with disabilities. These discussions could signal a notable change on the horizon. Although no official decision has been made, if you or your loved ones are using Medicaid, this is an important time to stay informed and closely monitor developments before May begins. Follow the Benefits Uncovered channel. We will continuously update from official sources and provide clear analysis of each impact to help you make the right decisions in a daily changing context. The debate on Medicaid cuts. In recent weeks, a budget cut proposal being considered by the U.S. Congress has attracted significant attention. According to the plan, the House Energy and Commerce Committee is responsible for identifying adjustable expenditures, with an overall goal of saving about $880 billion in the coming period. Within this proposal, Medicaid is one of the programs that may be considered for funding adjustments. Medicaid currently provides healthcare services to more than 72 million Americans. It is an important part of the health welfare support system for vulnerable groups, including the elderly, people with disabilities, and low-income families. Therefore, changes related to this program are raising various opinions among legislators. A group of 12 House members from the Republican Party sent a letter to the Speaker of the House expressing their views on the budget proposal being put forward. In the letter, they stated they would not support the budget package if it includes deep adjustments related to Medicaid. This group argues that many voters in the districts they represent rely on the program to maintain access to essential healthcare services. Beside the federal level debate, some states are also being placed on alert. According to a new report from the Robert Wood Johnson Foundation, if new conditions on work requirements are applied to Medicaid recipients, at least 10,000 people in almost every state that expanded Medicaid would lose coverage. The largest expected impact will fall on states with large populations, such as California, with 1 to 1.2 million people potentially losing insurance, New York with about 743,000 to 846,000 people. Other states that could be heavily affected include Arizona, Illinois, Indiana, Kentucky, Louisiana, Michigan, New Jersey, North Carolina, Ohio, Pennsylvania, and Washington. Each state could see more than 100,000 people lose access to Medicaid. Additionally, some states are currently operating under conditional funding mechanisms. According to the Center for American Progress, 12 states, including Arizona, Indiana, Montana, and New Hampshire, have trigger laws requiring them to cancel Medicaid expansion if federal contributions drop below 90%. This change alone could eliminate coverage for more than 3.6 million people. If that regulation is triggered, cuts may not come from direct federal decisions, but arise from the state no longer having the qualifications or resources to maintain the program. What will happen to those who depend on Medicaid if it changes? The proposal to adjust the Medicaid budget is set against the backdrop of Congress examining a broader fiscal plan aimed at balancing federal spending. Some arguments put forward include the desire to review recipient eligibility, apply work requirements to eligible individuals, and adjust federal funding levels for states that have expanded Medicaid. These proposals are expected to help save budget without affecting those who truly need assistance. The chairman of the Energy and Commerce Committee, Brett Guthrie, stated that about $170 billion could be saved by more carefully reviewing recipient eligibility. This is not intended to cut legitimate benefits, but to ensure the program serves those who truly need support. However, in the adjustment process, one thing that cannot be overlooked is the indirect effects on specific population groups. Many elderly people are currently receiving medical care at home thanks to Medicaid, an option that allows them to live near family instead of having to move into nursing facilities. Many people with disabilities are using physical therapy services, rehabilitation, or daily assistive devices also through this insurance. If the program is narrowed or eligibility conditions change, not everyone will immediately know about it. Many people may experience service interruptions simply because they haven't yet understood the new procedures, something worth noting when implementing any reforms related to essential benefits. For low-income families, paying for private health insurance themselves is not easy. High fees, complex procedures, and language or technology barriers sometimes cause them to choose silent solutions, delay treatment, or ignore early disease signs. Such choices, if prolonged, can lead to unwanted consequences both in health and long-term costs. In a context where much remains unclear, perhaps the most important thing right now is not to worry, but to prepare. Following accurate information, understanding changing conditions, and especially knowing your own rights will help each person make appropriate decisions during this transition period. Medicaid may change. What you can do today before everything changes at a time when many proposals are still being discussed and no official decisions have been made, the most important thing for each individual is to maintain proactivity and understand their position in the system. If you or your loved ones are using Medicaid, take time to check your personal information, insurance records, and eligibility conditions currently applied in your state. Following updates from official sources, including your state's Medicaid website, the Social Security Administration, or community and health organizations, can help you not miss any changes that could directly affect your benefits. If you're in a group needing long-term support or caring for elderly relatives, explore potential alternative options, from local medical assistance programs to nonprofit organizations. And above all, keep yourself fully informed, because this not only helps you protect your current benefits, but also helps you make wiser choices if future changes occur. Although much remains undecided, actively updating information and understanding your rights is always a necessary step. If you want to continue receiving clear, official, and easy to understand analyses about changes related to Medicaid and other welfare programs, follow the Benefits Uncovered channel so you don't miss any important information that could affect your life and family. See you in the next video.